Hi, Dr. Yass here. And I basically want to pose a question to everybody in terms of how can you trust the existing medical establishment to provide you the right information regarding how you should treat your chronic pain. Trust is something that has to be earned, and I think that for just a very, very long time, for hundreds of years, the medical establishment was kind of given a free pass simply because it was thought that the individual went to medical school, and through medical school they would be provided the proper education, and experience would develop to where they would be very capable of providing the kind of care that would achieve the goals of those seeking medical attention. But the issue of chronic pain is very different in the sense that it really only developed in the mid-1980s, strangely enough, as a result of the MRI. Not in spite of it, but as a result of it. And if you were to look since the creation of the MRI and the simultaneous development of certain enhanced surgical procedures such as arthroscopy, which is the use of very small incisions and placing cameras into the joint to be able to perform the surgery, versus an incision, a very long incision being performed and the joint open to see what's happening in the joint, you would be stunned to find out that there has been a meteoric rise in the number of people who are suffering from chronic pain since the creation of both the MRI and these advanced surgical procedures. So the whole idea and the thought was, especially with the surgical procedures, was that, wow, we're going to go from this very long incision and the trauma to the joint of having to open it up so we can see the extent of the rehabilitation and the healing process should be dwarfed. Now that we have these little 3-inch long incisions and we just stick the camera in and we don't have to do much, and we're shortening up the surgical time frame, and wow, people should be recovering better and healing, and this is going to be incredible. And yet, over the last 10 to 15 years, the number of people suffering from chronic pain has gone up insurmountably. When I wrote my first book in 2008, I was doing research, and it was estimated that 75 million people in the United States suffer from chronic pain. By the time my new book came out in 2015, the number had already reached 126 million. And so clearly, the numbers of those suffering is skyrocketing. The time frame people are suffering is increasing. We could look at the fact that 22 million adult Americans now are addicted to prescription pain medication. We now, since we no longer can use the prescription pain medication to the extent that they were using it, are now moving towards more bizarre, extreme circumstances like performing radiofrequency ablations and rhizotomies, which are the cauterizing of nerves or the severing of nerves. You don't need a lot of scientific evidence. All you have to do is look around you. Look at family, friends, neighbors, co-workers. Everybody now knows somebody who's had a failed back surgery, a failed hip or knee replacement. I mean, clearly it's not working. The evidence is overwhelming, whether we're talking about theoretically the worthless, inappropriate idea that MRIs actually identify the cause of pain by identifying these structural variations like herniated disc, stenosis, arthritis, meniscal tears, any of these type things. It turns out they're completely independent. You have to appreciate that the whole scam of the circumstance is that you always take the MRI when you're in pain, So when they find the structural variation, wow, look, we can now say that the structural variation must be causing the pain because I found the structural variation when you're in pain. But you have to recognize, what would you think it would have happened if your pain began 2 weeks ago and you had taken the MRI 2 weeks and a day ago, or 2 weeks and 1 month ago, or 2 weeks and 3 months ago? If you had taken the MRI back then before you even had the pain, the structural variations would have been found and you wouldn't have had pain. How do you know that? Because studies have been done on people who didn't have pain. And it found that over the age of 60, 90% of those people who don't have back pain have degenerative or bulging discs. That's how you know these structural variations simply progress, probably from the time you're 20, and just slowly deteriorate over time, so slow that it doesn't even ignite a pain signal. That's why you can find 90% of the population over the age of 60 with no back pain having bulging or degenerative discs. When you look at the meniscal tear in the knee, one study showed of those people who have knee pain, 63% of those who had the knee pain had meniscal tears, while 60% of those people who didn't have knee pain have meniscal tears. 63 for those who have pain, 60% for those who don't have pain. Clearly, it's about the same number, so it doesn't matter whether you have pain or do have pain. The fact is, roughly 60% of the population will end up with meniscal tears. So, whether we're looking at the scientific evidence, whether we're looking at the empirical evidence, all these people who are suffering, the fact that they created the diagnosis, failed back surgery syndrome, the medical establishment themselves created a diagnosis to account for the fact you're getting the surgery and yet you still have pain after the fact. They needed to create a diagnosis so they could then continue to treat you, even after the treatment they did failed. So they create failed back surgery syndrome. I mean, with all this evidence, all the indications this is complete insanity, how could you possibly trust this overall system? Why would they even deserve your trust? These are the questions you really have to answer. Let's think about this. Pain is an indication of a tissue in distress. That's why you have pain. Everyone should acknowledge. The reason your body's eliciting pain is because there's a tissue that's in distress. It's not working properly. The tissue is trying to make your brain aware that it's not working properly. It wants an intervention. It wants treatment to help reorganize it and get it to work properly, so it admits pain. Pain is that security signal to allow the brain to know something's wrong in the body. So, if in fact you're having pain, you go to a medical practitioner, a diagnosis is achieved, a particular tissue is identified, you get a procedure, including a surgery, to that tissue, and the symptom still exists after the surgery, you have no alternative. There literally is no other way to look at this other than the wrong tissue was identified and treated. How would you know that? Because if the right tissue that was emitting the pain signal was treated, and you treated the right tissue, the distress of the tissue would be ended, and the distress signal would no longer be needed, so the pain would cease. So, if you're still having the same symptom after you've had a surgery or a procedure or whatever is going on, the fact is that if you still have the symptom after the procedure, clearly the wrong tissue has been treated. Now, you have to say, how's this possible? How is it possible that this overall medical establishment can be so wrong and not warrant your trust? And the answer is a mechanism that is used when you first enter the system, which is the diagnostic mechanism of using MRIs, is invalid. Invalid. You have a 90 to 95% chance of being misdiagnosed by use of the MRI. So that can't be confusing when, after the wrong tissue is identified through this false mechanism, that you're still going to have a symptom and therefore the wrong tissue has to be acknowledged to be treated. What's also important to understand is that the primary tissue that elicits pain in more than 95 to 98% of cases, which is muscle, can never show up on diagnostic tests. You must appreciate if you have a back muscle in spasm, it doesn't show up on an MRI. If you have knee pain because the kneecap is being excessively compressed because the front thigh muscle is too strong in relationship to the back thigh muscle and it's pulling excessively on your kneecap, ain't going to show up. You could have a strained rotator cuff, and as a result, as you raise your arm, the head of the arm bone is not held where it should, and it rises up and pinches on your bicep. Doesn't show up on an MRI. You could have pain under your foot, plantar fasciitis, which is the result of a strained hip muscle, which limits the ability to weight bear properly, causing you to miss improperly weight bear, which makes you weight bear towards the inside of the foot, ends up straining certain muscles, causing there to be increased lengthening of your plantar fascia, leading to pain. Doesn't show up on an MRI. I mean, I can go on and on and on about the multitude of muscular causes that will never show up on an MRI, and yet the MRI is used. So, if you want to get the right diagnosis and you want something to trust, something that you feel through an understanding of how the method works, you can trust and believe will get the right diagnosis and the right tissue, then you need to come and find the Yass method. It's the only method that interprets the body's presentation of symptoms to identify which tissue is eliciting those symptoms, which is exactly how the body wanted it to work. That's why it's eliciting the symptoms. You just have to be able to interpret them to know what tissue it is. And the best part is the Yass method can identify all potential tissues. MRIs cannot. There are no medical practitioners educated and designed to identify muscular causes. So, my suggestion to you, find the Yass method, examine it, understand it, and if you see it for what it is, the only true method to properly diagnose, trust it. Use it, get the benefits, resolve your symptoms, and get your life back. If you want more information about the Yass method, go to my website, www.mitchellyass.com. You can email me at drmitch@mitchellyass.com, drmitch@mitchellyass.com, or call me on my cell phone, 516-449-1359. Let me make this very clear. The Yass method wants to earn your trust. It doesn't expect it simply because it exists. It will earn your trust by proving to you it is the only true mechanism that will achieve your goals. What is the goals? What are your goals? Why are you entering the medical system? You want your symptoms resolved. You want your quality of life back. You want full function. That's what the Yass method will get you. That's what you will finally be able to trust in something relating to the treatment of your chronic pain. That's the Yass method. For now, this is Dr. Mitchell Yass, wishing you a pain-free, fully functional life. Bye-bye.